2, 1.
Good afternoon, everybody. This is the Thurston County Board of Health meeting 2/11/2025, and it's starting at 3:50. Welcome, everybody. Welcome. Now we can get on to substance. Oh, forgot that. So let's, can we do the agenda first? Alright, so let's do minutes first. We have a motion from Commissioner Clerk, and then second from Commissioner. All in favor?
Aye.
Any opposed or abstaining? Alright. Moving on now to approve the agenda or adding to it. Any other comments or? All right, we will get rolling with our agenda as laid out. So, oh, sorry. You tell I'm out of practice. All right, all in favor of approving the agenda?
Aye.
All right, any opposed? All right, we are ready to roll.
All right, thank you, Dr. Jen Freiheit, Director of Public Health and Social Services. We have 2 proclamations tonight. Our first proclamation is around National Donor Day, which happens to be this Friday. And first, I would like to call up several of our community members and partners to the table. So I will call up Manny Martinez, the president of Relentless Leadership LLC and the American Red Cross board member. I'll call up Shannon Glenn, Community Affairs Manager for Puget Sound Energy and American Red Cross board member. And there are chairs right up here. Heath Palin McBee, District Manager and Washington Biomedical Services for American Red Cross. And Jenny McCoy, Community Engagement Coordinator for Bloodworks Northwest. Oh, I just saw an extra name. James Moore, Olympia Collection Supervisor for Bloodworks Northwest. So we will crowd around and keep our presentation brief, but we will talk a little bit about donation, and then we will talk about the call to action for ourselves in the community. So I will turn it over to whoever's speaking first then. If you'd like to. Should we bring your chair? Let's bring in your chair.
You want to go first?
Sure, I'll go first. My name is Jenny McCoy. I'm with Bloodworks Northwest, and I thank you for inviting us here today. There's 2 topics I love to talk about: my grandchildren and blood. So I'm very happy to be here and helping accept this proclamation. But studies have shown that the #1 reason people don't donate blood is because they haven't been asked. And Bloodworks Northwest has been around the community for about 75 years under a couple different names. And we've been asking the community to help step up and give blood for the last 75 years. And that job never goes away. We are always in need for blood. Right now, we supply about 100 hospitals in the Pacific Northwest from Bellingham, Washington, down to Eugene, Oregon. So in order to keep up with that demand for those hospitals, we need 1,000 donors every single day. And that keeps James and myself very busy. And so every 2 seconds, somebody in the United States needs a blood transfusion. I think all of us know someone that has either had a blood transfusion because of being treated by cancer, have family members that have maybe suffered trauma, but it touches all of us. But I really appreciate being invited here today to raise awareness of the need, because the need never goes away. It never will go away until the medical community can manufacture artificial blood, which I don't think is happening anytime soon. But I appreciate having the time to talk a little about the need for blood and the need for us in the community to step up and give an hour of our time to save the lives of up to 3 people within that hour. So I thank you for your time today, and I'm going to turn it over to James Moore, my colleague.
Yes, thanks for your time today. My name is James, of course, with Bloodworks. I supervise the Olympia teams. And a big thank you for raising awareness for the need for blood. The mission we serve is a really critical and unique mission. It really is a partnership with our donors and our local patients. And as Jenny mentioned, it does take 1,000 dedicated donors each day to serve that need. Any donated blood, if you donate at our center or one of our mobile units, it's generally available to patients within 24 hours. And let's see, whether patients are undergoing emergency care, fighting cancer, sickle cell disease, they rely on blood transfusions for that healing, and that means we need dedicated donors each day. And regular donations is what's critical to ensure we don't run out. So with that, any increased awareness of that need will directly result in lives saved and patients healed. And so fully support recognizing February 14th as Blood Donor Day. Thank you.
And Keith, Hale McBee with the Red Cross, thank you. I'm going to say ditto to a lot of things that they said on donor awareness and the need for blood. The Red Cross has been saving lives in Thurston County for over 100 years in many different ways. And bringing the awareness and the importance for blood and donors is really, really important. As we get through the holidays and as we get through January, donors tend to start losing interest in coming in and finding new ways. So Thurston County making February 14th Donor Day is really, really important to the need, especially in the month of February with Black History Month and the need of sickle cell awareness and the need of donors coming in and supporting that. February 14th is a very important day for us to help recognize on all of those fronts. So thank you so much for bringing awareness and helping donors come in and donate. And I think my other partners would like to add in a little bit more about Red Cross.
Absolutely. I'm a board member for the Red Cross. This is not my day job, but it's a job that I take very seriously because, as you know, you see the news where there's disaster, where there is a fire, where people are displaced, the Red Cross is there. And often I get asked, what kind of things can I do to support the Red Cross? Well, first, you can volunteer. You can volunteer your time and your efforts to help the Red Cross in times of disaster, but also during times when a disaster is not happening. There are things that happen with the Red Cross, from home fire campaigns to, of course, blood donations, which is a very important part of our mission. If you've never done it, I would recommend go and donate blood. It doesn't take very talent or skill. We can all pretty much do it, which is pretty great. And of course, as a board member, there is an opportunity for you also to, if you can't part with your blood and you can't part with your time, you can always donate money. So I just wanted to let you know that that's also available to you. Thank you.
I guess I'll just add that in our community, the Red Cross has responded to 285 home fires in the past year, which is pretty significant. And the Red Cross is about 90% volunteer run. So it takes people and people with passion to make all this work.
Thanks so much. And as a person whose life was saved with blood donation, I'm very grateful for all the blood donors, and we have other people on our committee as well who have received blood transfusions that have really helped us in our health. So
And I'll just say, so I've got tears because I have a child that was recently diagnosed with cancer, with leukemia, and has had several blood transfusions for the last couple months, and I have given blood. So working for the state agencies in the past, we had bans, and so I have given blood many times, platelets anytime I can. Until you actually see it, in use, do you realize the impact you're making? So thank you.
all right, so let's
Want to talk about our blood donor challenge. And so we have done a blood donor challenge this year. And so just based on this proclamation and to recognize the blood shortage and the National Donor Day on February 11th during the regularly scheduled Board of Health meeting, we invite the public to join us on this important moment and ask that you consider donating blood. And this month to support our local hospitals and healthcare workers during this critical time. And your generosity can make a life-saving difference for patients in need. And we've heard two of our board members here talk about how it really is life-changing. So we're encouraging all members to really take a pledge to donate blood and share commitments on social media and using the hashtag TCPHSS and #BloodDonor. And by posting, you'll help inspire others to do the same and amplify the impact of this challenge. So hoping that people can make appointments. I just donated blood beginning of December, so I have to do my 12-week mandatory waiting period. But I already have an appointment for February 28th, and just thank you for all the work that you do in getting these resources out to our community.
So, yeah.
It's in our packet. A little bit more about that. We have social media, so please tag on and share the social media.
So we read the proclamation. All right, are you okay starting, Commissioner Clerk?
Absolutely, thank you. Thank you to all of our guests. I really appreciate your time, and I know the rest of the board does as well. So today we will read the proclamation for National Donor Day. Whereas National Donor Day is observed on February 14th each year to recognize the critical role of organ, tissue, and blood donors play in saving lives and improving the health of individuals across the nation, and
whereas National Donor Day is dedicated to raising awareness about the importance of life-saving donation and encouraging individuals to consider becoming donors in order to help those in need of transplants, transfusions, and other medical procedures, and
whereas blood, tissue, and organ donations are essential in saving lives, as they help those with a wide variety of illnesses and are used to treat individuals with life-threatening injuries or serious burns, individuals undergoing surgery, those undergoing long-term medical treatments, those with blood disorders, and or those with unique medical need, and
whereas 462 organ and tissue donations were made during 2024 in Washington State, while about 1,500 people remain on the organ transplant waiting list, and transplant wait lists often taking more than 100 days. And
whereas blood banks in Washington are currently urging residents to donate blood after available supplies reach alarming low levels in January, and
Whereas local blood donation organizations in Thurston County rely on volunteer blood donors to help meet the needs of individuals battling illnesses and maintain a steady supply of life-saving blood products for our community hospitals. Nearly 200,000 units of blood is needed annually to meet regional needs, according to the American Red Cross. And
whereas National Donor Day honors the memory of those who have passed while celebrating the generosity of those who donate, as well as the incredible work of healthcare professionals and organizations dedicated to facilitating the donation process and saving lives, and
now therefore be it resolved, the Thurston County Board of Health hereby proclaims February 14th, 2025 as National Donor Day in Thurston County and urges residents to consider becoming a donor on this day and throughout the year to save lives in our community and beyond.
all right, shall you take a picture?
Yes, so please join us out on the stairs. We'd like to take a big picture and share it via social media that we've proclaimed this today, so.
I think one of the proclamations.
Don't worry, you're fine, I know, we make do.
I feel like that scene in Mean Girls when you drown.
We're government, we make do, all right. Grab one of them proclamations. Do you have the donor one? Yeah, one. If not, there's this one here. Okay, we'll do this.
all right.
All right. We'll be right back. Oh, yeah.
Trying to figure out when my feet wouldn't reach the ground, and I'm in Kai's chair. Just swinging.
Sorry, I'm gonna give that to you. Thank you, sir. All right. Our second proclamation for the night is in honor of National School Counseling Week, which was February 3rd to February 7th. So it's past, but we are still honoring it because school counselors are needed every day. So I'd like to call up Erin Wick, who's the Executive Director of Integrated Student Supports, AESD Behavioral Health Student Assistance Program, the state lead for Capital Region ESD 113. There's a slight name change from your agenda. And I will also call up Laura Conklin, Director of Inclusive Schools and Systems for Olympia School District. Thank you for joining us. Go ahead and start whenever you
Okay. So I am here on behalf of the Thurston County Superintendent's Group. So we have a statement from them for you. On behalf of the superintendents of Thurston County School Districts and ESD 113, we want to extend our heartfelt thanks as we celebrate National School Counseling Week. We are truly grateful for this proclamation and for the continued recognition of the vital role school counselors play in our communities. School counselors' dedication to promoting academic success, supporting mental health, and fostering the overall well-being of students is remarkable. They are often the first to offer a kind word or a listening ear when students face challenges, from mental health struggles to housing instability to family issues. Their tireless efforts in providing emotional support, academic guidance, and career planning have lasting impact on every student they touch. By connecting families to essential resources and advocating for students with special needs, school counselors help to ensure that every child has the opportunity to succeed. In addition to their work with individual students and families, they help create a safer, more inclusive school climate through anti-bullying initiatives and peer mediation. Their commitment helps build an environment where students can grow, learn, and thrive both in and out of the classroom. We deeply appreciate the Board of Health's recognition of National School Counseling Week and the ongoing collaboration to support the well-being of students in Thurston County. Thank you for all you do as we celebrate National School Counseling Week. Please know that the hard work and dedication of school counselors does not go unnoticed. We are proud to honor them for their invaluable contributions to schools and communities. Thank you.
Thank you.
All right, my name is Laura Conklin. I'm the Director of Inclusive Schools and Systems in the Olympia School District, which means that I get to work alongside school counselors. So I get to work alongside about 31 counselors in 19 different schools, and started in education 15 years ago myself as a school counselor at Franklin Pierce High School. I'm in every job that I have, I always try to connect back to school counselors because of the incredible work that they do. So in my current role, I meet every single month with leads at the elementary, middle school, and high school. And we plan out what an intentional K-12 vertically aligned program looks like around college career readiness, social emotional learning, and academics, which is all of school, right? One of the wonderful things about counselors is they have such a deep appreciation and understanding of students as whole people. And so that piece around wellness and the future is so incredibly important to our school counselors. School counselors are defined as leaders, collaborators, and advocates. And so we naturally collaborate with many groups. Just this last month, we were able to partner with our district social workers and sat around at a table much like this and processed through how to support families that are being impacted by immigration. That was a really powerful conversation where we talked about what our policies are in the district and how to follow those, and also to how to support our families on a human level. And so our counselors are often on the front lines, the ones receiving and are the safe people for many of our families.
So again, over the past 15 years, I've been a school counselor. I've been able to supervise counselors. I've provided professional development at the building, state, district, and national level. I'm married to an elementary school counselor, so I have to plug elementary school counseling as well. And one of the things that I think is so amazing is that the role is different depending on the age group. So, you know, I support elementary, and so I've witnessed the impact of elementary counselors when they're teaching young students about safety, about emotional regulation, about problem solving, being a part of a community. Our middle school counselors provide safe spaces for our students as they're kind of grappling with who they are as individuals. Our high school counselors have to be experts at all sorts of things and are really connecting learning that's happening in buildings to future, right? And that's life-saving work. So they co-construct those plans, they put those things together, and all of that is by prioritizing wellness. Again, school counselors see students as whole people. They're often championing equity, removing barriers, challenging systems. That is weighty work. And again, they're sitting in their offices, sometimes receiving students who have had to navigate systems and barriers that schools have thrown in front of groups of individuals. Counselors are on the front line with social workers when tragedy strikes. A few years ago at Olympia High School, there were a few students within the same graduating class that both tragically died, and it was the counselors and the social workers that stood in front of those groups of students as they were looking for guidance, in front of those families as they were trying to address how to support all of these students, and in front of staff. They're oftentimes also in the front line for adults.
So which one you think is better? Oh, here,
Whichever is convenient for you.
If you didn't have to mute during Zoom, you're really not Zooming.
Yeah.
I think one of the pieces that we don't often talk about in education is the belief gap that we have. Our counselors understand that. They understand that it's not just about setting up these systems, it's not just about receiving students, it's also about advocating about the incredible work or the importance of the adults' belief in the ability of students and the students' belief in their own ability, and that can really shape what happens for the rest of their lives. So for all of these reasons, again, I try to connect with school counselors as frequently as possible. They are wonderful people. They are courageous and empathetic. And again, they are doing life-saving work when it comes to not just our students, but our family and also our staff. So thank you so much.
Yeah. All right. So you want to start on your end reading the proclamation this time?
Sure.
Just to keep you on your toes.
Keep me on my toes. My life was profoundly influenced by two school counselors, Mom and Stepmom. So
Nice.
I reach out to my counselors every. Okay, Thurston County Proclamation for National School Counseling Week. Whereas National School Counseling Week is observed from February 3rd through 7th, 2025, with the theme School Counseling, Helping Students Thrive. This week highlights the important role counselors play in the school systems. And
whereas school counselors help families focus on ways to further the academic, career, and social emotional development of their children, and
This way. All right, whereas school counselors work with teachers and other educators to help students explore their potential and set realistic goals for themselves, and
whereas school counselors seek to identify and utilize community resources that can enhance and complement comprehensive school counseling programs and help students become productive members of society, and
whereas student-to-school counselor ratios in Washington are ranked 13th in the nation, typically seeing 441 students on average per counselor, and
whereas in Thurston County, there are approximately 103 school counselors working in public schools, assisting over 42,000 students across 9 school districts, fostering a nurturing and supportive environment for academic success,
career readiness, and emotional well-being, and
Whereas the school counselors in Thurston County are an integral part of the educational team, working to reduce barriers to student success and preparing students for a prosperous future by providing guidance on academic achievement, personal growth, and career development, and
Now therefore be it resolved, the Thurston County Board of Health hereby proclaims February 3rd through 7th, 2025 as National School Counseling Week in recognition of the valuable contributions school counselors make to the academic, personal, and professional development of students across Thurston County. The board celebrates the hard work and dedication of school counselors and commit to supporting their continued efforts to help students thrive.
thank you.
Great.
Photo
All right.
time.
Photo.
Photo time. Now it's your turn, out on the stairs. All right.
Who's here with Northwestern Public Schools?
I wasn't sure I was.
Yeah, come on up.
I wasn't sure if I was talking, so I didn't put my name on there. I'm Teresa Wolf, and I'm the mental health specialist at Northwestern Public Schools. There's actually 13 of us now, and we started with 3. So the mental health support team works with the school counselors. So the school counselors are like the first line of defense, and then they send us in for individualized students and when there's crises within our district, as well as the support to any other districts that ask for us to come. So I've been working in the school district forever and ever. I think it was 2012 when I started with the Safe Schools Healthy Students grant, working with community mental health in our schools. And now North Thurston has dedicated funds to continue that program specifically in our district.
Thank you.
Thank you so much.
Great. Anybody else in the audience here for this? Please join us with the photo as well too.
Come on, Terry, you want to get
Thank you.
Here we go.
That's a lot of candies. Towards each one, and then it would just be like.
It's good to see you.
Yeah. Like one will be like.
Yeah.
It's a really good idea.
We usually do at this meeting.
We can do more than a report.
All right, next we have a opportunity for the public to address the board, and we've had 2 people sign up who would like to speak. So I'll just read off sort of the guidelines before, and then I'll call them up. So the Board of Thurston County Commissioners welcomes, the Thurston County Board of Health welcomes comments from the public at all meetings. However, there are some guidelines governing such comments to ensure that they are appropriate and do not take advantage of the fact that most meetings are televised. General speaking guidelines, please introduce yourself, including your the address you reside in the county. Please address the board, not the audience or staff. Please silence your cell phones. The board does not respond to public comments on a need basis. The county manager will follow up with specific items. Speakers are limited to a total of 3 minutes. I would be willing to give up to 4 since we only have 2 people signed up. Meeting attendees cannot donate their speaking time to another person. Reserves the right to restrict a person's opportunity to address the meeting for a good cause. No comments that are lewd, offensive, inflammatory, hateful, defamatory, or discriminatory in nature. Please be respectful. No outbursts of any kind. No comments that are commercial in nature, such as promoting a for-profit business. Let's see. And remarks about pending land use permits, similar matters, etc. Come before the Board of Appeal. So, I know it said 3 on here, but 4, I think we have only 2 people signed up. So. All right, so it looks like the first person signed up was Sue Kokla. Did I say that right? I'm sorry if I mispronounced.
Okay, no one never does. Hi everyone, my name is Sue Kogleful and I live on Bud Street in Olympia. A year ago, so February 2024, I received a letter / invoice similar to this from Thurston County Environmental Health. Sorry. It's the operational certificate for the on-site sewage system. I was relatively new to the area, having moved from Pierce County, and had never heard of this program. And I was wondering, what is this fee? Last year was $170, and what was it for? So fortunately, the letter included a contact phone number because I had questions. First of all, I'd like to say to the board that anyone that I've spoken to or emailed with, and that was several members of your department, they've all been very courteous, knowledgeable, and helpful. The first 2 people I spoke with were Sandy Patnode Parish and Jeannie, I don't know, Mountjoy Venning, who provided me with much of the information for the basis of the letter that I wrote to you, the commissioners, a year ago. There's a copy of my letter that I wrote a year ago to the board, who's here. I think you might have gotten a copy as well. It's dated February 6, 2024, which both Sandy and Jean encouraged me to write. The highlights. As seen on the invoice right here that we got, it was originally approved in 2008, and it says the money that is collected here pays for Thurston County to manage more than 70,000 septic systems in the county. This includes collecting and managing system design, location, maintenance records, informing owners of the state and regulations, ensuring compliance, and preparing educational opportunities through workshops, website, written materials, and one-on-one technical assistance. That's for 70,000 septic users in Thurston County. So though these are probably costly, these all appear to be necessary and beneficial, but here's the issue. They benefit all 70,000 septic households, and yet the certification fees that pay for all these services are not collected from 70,000 septic owners. According to Sandy, they are only collected from 1/4 to 1/3 of Thurston County septic owners, based on type of septic system and or location. So only a fraction of septic users, like myself, are sent bills to subsidize the entire program, which benefits all. That is why the fee is so exorbitant for all those of us who do receive a bill, and I don't think that's very fair. In my letter that I wrote a year ago, Ms. Mountjoy Venning states that others have also complained about this, and this was a year ago, and she said at that time that the commissioners had already discussed changing the billing policy to make this more equitable. So this has been going on for years, but so far nothing had been done. And in an effort to make the program pay for itself, you were billing people with the more environmental, more costly systems like myself, who have to have it professionally inspected. Mine's inspected twice a year for a total cost to me of $500. And you make people like us with probably the better systems pay for this service for all 70,000 people with septic systems. A short time after I mailed this letter, I received an email dated February 29, 2024, so again a year ago. I have a copy of the email with me right here. It was sent to me from Thomasina Cooper, and she said that Commissioner Messner asked that I reach out to you. She said, on-site septic management is a top priority of TIES and a frequent topic of board discussion. In following up with environmental health staff about your letter, we were happy to hear that they are bringing forth a proposal for the reform of our septic operations and maintenance system in the very near future. As I said, this is February 29, 2024. We anticipate this will help us address directly the problems you identified in your letter. And I responded, that's absolutely awesome, and please keep me updated. Unfortunately, I never heard from her again. So it's been a year, and I'm thinking that everything's gone forward, that this has been a topic that's been addressed many times, that finally you're going to address it and reform the system and make it more equitable so everyone's billed for the system and not just a few of us. And then just yesterday, I received my bill. So last year was $170, this year it's $180. So my question to the board is, was a proposal ever made last year as promised to me? Was anything ever done? Is everyone going to be billed for this program, or is it still going to be a quarter to a third of us billed for this program that benefits 70,000 people?
Just during public comment, there's no back and forth.
Okay.
So if you could provide the information to the assistant county manager and then staff to get back to you.
Okay.
Is that okay? I'm sorry.
I just need your information.
Thank you.
Okay, great. Okay, thank you.
Thanks for coming. All right, and we also had Terry Ballard sign up if you want to come in.
Good afternoon, Health Board. My name's Terry Ballard. I live in unincorporated Thurston County, and I am the Democratic PCO for Lydia Hawk, which is all of Tanglewild. I'm very concerned about our homeless people. The rate keeps on going up. We spend more and more money. I saw $10 million spent out of this, out of the disbursement by the county. $10 million, and we only have 864 homeless people? Well, let's take that down, okay? There are 97 unmappable transit sexual predators out there, class 1 to 3. There are 53 that are non-compliant, class 1 to 3. There are 3 non-compliant that are level 3s, the most important. And out of all of the 97 unmappables, we have 12 people that are level 3 total. Where's my safety here? Who is abiding by my safety, especially in unincorporated Thurston County, which has 0.7 per 1,000 officers to help us out for my Tanglewild. Public safety. We're at 38 to 39. We're at the lowest per person in the county, okay? In our county, out of the state. I was a victim. $13,000. I was on medical, recovering from medical in my rebuild. This guy came in and stole $13,000 and a 5th generation Bible. That is disgrace. You know what they did? They let him go, okay? And I have a no contact with a court order. Do you know what? I called with the no contact order and he violated. Oh, I have to do something else. Really? Really? To get this homeless guy? 150 measures, you guys got it, for sleeping or storing on public lands since the piece of paper you have. Lacey has a no panhandling ordinance called 5.21. Wouldn't the businesses in Olympia get those ordinance done like that so the businesses won't be bothered with homeless? Out of population of per 10,000, out of 10, Thurston County is at number 7, with neighboring counties, Pierce at 28% and Kitsap at 21%. What are we doing to get rid of the homeless? Are we helping them out, or are we paying these 501c3s to keep the homeless homeless? There are 417 unsheltered, 400 sheltered, 47 transitional, and 3% are veterans. There's no such thing as a homeless veteran. If he needs help, he calls the veteran VA. They'll house him, clothe him, put him through drug rehab. They'll do everything to get him off the street. Homeless comprise of over 85% of the drug, they have a drug addiction. Over 85%. And 4%, in addition to the 85%, have a mental illness. Does my Board of Health care about that? Care about developing anything for this? No, they don't. Okay? In 2022, we had 724. In 2023, we had 750. In 2024, we had 952. 212 increase. $10 million spent on homeless? Really? The power of the purse are your commissioners right here. They are the power of the purse. Those are the ones that gave these 501c3s $10 million of the home consortium fund. Okay, we need to help the community. We need to start policing, and we need to get these homeless off our streets. Thank you.
Thanks for coming. All right, next. Is there anyone on Zoom who wanted to make public comment? All right. All right, so next is our good friend Susan to give us an update on the hearing officer appointment resolution.
Good afternoon. Susan, Environmental Health Division Director. So just a little brief history on this resolution. Article 1 allows the right to administrative hearing to appeal a decision of the health officer. So this could be a permit decision, an order, or a requirement. So this resolution continues to appoint Sharon Weiss as our primary hearing officer. However, she is unavailable. The resolution appoints Brian T. McGinn, the Community Planning and Economic Development Pro Tem hearing examiner, to serve as the backup hearing officer for PHSS. The resolution also appoints persons employed in the position of PHSS Director, Health Officer, Environmental Health Division Director, or Program Manager to fulfill this role should Sharon and Brian be unavailable. And I'd be happy to answer questions.
Any questions? All right, so we would need a motion. If anyone...
To approve resolution H1 2025.
Second that motion.
All in favor?
Aye.
Any abstaining or opposed? All right, should be good to go. Okay, and then Melanie had done some follow-up for us from the last meeting, and there's information in your packet that you can read specifically pertaining to some of the questions on trafficking and gray weather and
13 to 16 in the packet.
No.
This will come up in later whenever there's questions, and we'll have just include it as a report.
All right, and then we are ready for some subcommittee updates. And would you like to go first, Commissioner Klaus?
Thank you, Chair. So I'm giving a quick update on the Education and Outreach Subcommittee. We met on January 24th. I am really excited about the direction that we're taking with this subcommittee. We started out just like putting together the law and trying to see what sticks, because education and outreach encompasses so much. The one thing is busy, and when it comes to spreading the word about what we do, it feels like the sky's the limit. So we kind of started out with a sense of direction, but a ton of ideas. And then this month, we really seemed to kind of hone in on what we wanted to do. And so on page 17 of your packets, you will see something that kind of came to fruition. This is a schedule of the proclamations. And so what we had was to assist with the proclamation schedule and kind of navigating the complexity of going to the team presenters, bringing them here, making sure they feel prepared and confident when they address the board is a heavy lift, and our staff does a wonderful job with that. But we know it's sometimes difficult to find presenters, identify them, and get them here. In addition to all the other work staff is doing to make our meetings successful. So one of the things that came out of the subcommittee meeting was setting up what we would call an ambassador program. And this conversation kind of stemmed from the question, how can Board of Health members be ambassadors for public health? We want our Board of Health members to feel like there are plenty of opportunities to engage with the work that's being done here. This is not something that would be mandatory for Board of Health members, but it would be more so if you're interested in a specific topic and you're already connected in the community with a group or individuals who might be interested in coming to present, you can put your name down as a Board of Health ambassador. So, for example, so we're going to stay in August. If there was a Board of Health member or members who were really interested in that proclamation and wanted to engage with the community, they could say, hey, I'm really familiar with overdose awareness, and I would like to go out and engage with the community on this topic and find some presenters and work with staff to ensure that they're prepared and ready. And then if there's someone, it looks like we're calling it a Board of Health protocol. We didn't know what we were going to call it. We talked about a slide kick in the meeting, but it's better. So if there's someone on the Board of Health who's like, I'm really interested in overdose awareness, but I'm not plugged in the community and I want to learn more, then they can kind of tag along with the ambassador to learn more about what's going on in our community related to overdose awareness. So that allows for partnership. We had a conversation at the last Board of Health meeting, I think, about opportunities for mentorship. We had one member of the Board of Health interested in mentorship opportunities, and so we thought this would be a good idea to kind of tackle a couple of different angles that are floating around the Board of Health by providing an opportunity for more meaningful community engagement. And we also realized that this idea is like halfway baked, but not fully baked. So I think if it's okay with staff, we can maybe have a conversation around this if there's feedback. We also understand that just signing up, putting your name on here as a Board of Health ambassador and then going out and having a free-for-all in the community could cause some issues. So we talked about potentially putting together some sort of communications plan that would put parameters around what these discussions should look like, because we don't want people to inadvertently commit to something out in the community on behalf of the Board of Health that we can't actually do. So that's something that we're aware of, and we want to make sure that we have enough of a plan to where we're not setting people up to go out and accidentally overcommit or miscommunicate or anything like that. So with that, I will, I guess if it's okay with the chair and staff, open it up for conversation. That was the biggest update I had from this meeting, so that's all I have.
Yeah. Any comments or questions, or other spaghetti to throw on the wall, or?
I think, oh, go ahead. Yeah, I think the idea of having, a set task at hand and parameters in place would be really, really helpful. So not only do we know what we're going in with, but, we can all be kind of consistent, regardless of who's doing what work with whom. So, yeah, I like that.
Yeah, did you have a comment?
Just wondered if you find out how you solicit ambassadors or protégés.
So the list on page 17, that's a good question. It lays out all of the proclamations for the year, and then we would just have people sign up, and I think we talked about maybe having them do
email, I don't know if the staff had talked more about those since the meeting.
And to clarify, it would be us. We would be the ambassadors and we would be the proteges.
Yes.
Yeah. So yeah, it would just be through interest in emails. Yeah.
Or I mean, did you want to collect names like at this meeting, or did you want to do it later offline? Okay.
Pass the paper or email us.
So I'm new. Can I jump in real quick? Assistant County Manager Josh Goodman, so I'm taking over for this group. Thank you. And so I'm trying to get my handle around some of these topics. Helpful to understand who might be facilitating on staff some of this work. This is, I think, a great idea. We want to make sure that we're have the staff to facilitate these ideas. So I'm interested to hear how that might have been discussed.
Could I give a quick update? Yeah, absolutely. Jackie Gill, Board of Health Clerk, will be coming back on February 18. And so as the Board of Health Clerk, she will be helping, as she does with minutes, as Melanie's been pinch hitting in the interim, minutes, agendas, proclamations, getting all of that together. So there will be a tight relationship between the ambassador protege and our staff, myself, the Board of Health Clerk, to make sure that there's not duplication. The communication plan is also to help with that, to make sure, as mentioned, we're not either wrong or doing something.
Can I go back to Josh's point though? You know, like I'm looking at a sheet and I'm looking at septic, right? And that's usually Septic Smart Week. And that is usually staff coming in, or there are some of these where it's staff who's the liaison. And so as we're talking about not duplicating work, or that's kind of what, like, just going back to kind of Josh's point of like, what is.
Conversation. I think what we can do, Board of Health members, is take this back with Dr. Freiheit and look at how we can operationalize this, knowing that one clerk position has a lot on their plate. So I love the idea. I get the sense of we want community connection and engagement.
This also was part of the conversation around online staff, and sometimes we have guest speakers, as Commissioner Mejia said, sometimes these are facilitated by staff, so we wouldn't necessarily need an ambassador for every single one. And when there's not an ambassador for one, if there's not any interest, then staff would just go as they have in the past. But the idea is that this would take some of the load off of staff who maybe don't have connections in the community related to all of these topics, and it would allow someone from the Board of Health to kind of, so what we talked about, of course, this will be operationalized by staff, but what the concept was that the Board of Health ambassador maybe has a conversation with someone who might come to present, and then when they come to present, the ambassador sits next to them and kind of guides them. You know, that way we don't have people showing up and being like, where do I go? Where do I sit? What do I say? Because sometimes people get nervous, and so this would allow for like an ally in the room to kind of help people feel more confident when they come to present to the full board.
This may be a conversation for another time, but since we have a new board member and these Clerk, like the clerk of the Board of Health, I was always a little uncomfortable with that meeting because I saw the role quite a bit different or expansive than that, and this type of activity to me falls squarely within what I would have thought that person would. I mean, I understand there's a lot to there. We have to manage that workload, but this seems really squarely on, because that person was hired to provide administrative support to this expanded Board of Health that we never had before. The name of the position is Clerk of Board of Health. Depending on what you think that means, may not capture what the person, everything they do. I mean, so it's not ministerial, really. It's really about, it's subject matter expertise and and being able to help with expand the things that this board wants to do. Just to throw that out there. So I think that obviously Jacqueline's not here, but when she is here, this could be something that fits, or we could at least talk about that.
Yeah, I would just say, so since this subcommittee is education and outreach, right, is that, I'm going to give you my thoughts on this, which is I think this is great. I think that if the point is two things, which is to kind of working on this expanded group and what this group does and how this group gets out into the public and people know what the heck the Board of Health even does, because right now it's not clear. And I think this is a really good way when we think about education and outreach, as long as all of those parameters that you set in place, like the scope of what we should be doing and not doing, and and things like that. But I think it's a really good way to really begin developing relationships as ambassadors of the Board of Health. Yeah, so I think it's great. Yeah.
Yeah, we're really excited about it. Parameters are important, so we don't want to rush into it, but I appreciate that feedback, and we're really excited about the potential for relationship building.
Thank you so much.
Yeah, thank you.
Yeah. All right, are you up for
Let me see my notes real quick.
Data Committee?
So with the data committee, we talked a little bit about, since we had that little hiccup in doing our work, we went back and talked about what exactly we wanted to do with data and how it would incorporate into the ambassador idea also. So one thing that we would love to get into is a community health assessment. But right now we're not quite ready to start that process from the public health and social service side of it. But it is on their radar, and so that's going to be a 12-month process once they get going on that. The hospitals do have that. They have the community health needs assessment, and that's been put out by Providence and by Multicare, and so we would love to get more information on that from the data subcommittee. And then once we do have a little bit more data, we were thinking about incorporating some of that. How do we get data to be meaningful to the community? So one way we could do that is to incorporate an exchange of data with the people we have partnerships with, the community agencies we have partnerships with, for example, in the ambassador role. We would gather data from them and we would give them data that we have, and that would be one way to do it. Yeah.
Can I ask a follow-up on that? I think it's great. Thank you so much. I'm wondering in terms of the gathering of data for some, it's very new. And one of the things I've seen is everyone has a different metrics on the data that they collect. And so as we're sharing that data, how do we, have there been conversations about like how do we make sure that you're not reading it differently, or there's just like that it's actually helping instead of
yes, we have had conversations on that because we do understand that data can be so subjective and can be interpreted in many ways. So that is something that we're well aware of, and we're going to continue to have conversations on. Thank you. Yeah.
Anyone else with questions or comments? Okay. And then I personally would be very interested in data of different regions of the county. Mm-hmm. So like comparing like rural versus city, etc. as we look at things. And then as we know, currently finding data is getting to be a little bit hard to find sometimes. So it would be very nice to know we have some good accurate sources for our local information. So.
Yeah. And data means so much more when it is local. So I think that's something we're very interested in pursuing.
All right, would you like to go first?
Okay. Sorry, our public commenter is not still here. Because let me just start at the beginning. So we had our last meeting in September. We reconvened here last week, I think it was, to kind of recap where we left some of our discussions. The discussions from the summer and fall were about what approach should the policy subcommittee take. What we decided was to be kind of kind of grabbing spaghetti on the wall, as Commissioner Klaus said, like grabbing the spaghetti on the wall and kind of seeing like what are the 2 to 4 things that, not that we would decide, but that we've kind of had, these are the best baked or the most ripe or whatever criteria that we would then elevate to the Board of Health to say, here are the best ideas of all that spaghetti on the wall for policy work. What would we like to move forward? And we have, and so we got a bunch of ideas from staff. A lot of them related to the housing and homelessness issues. We had questions back in September about, how does the Board of Health really fit into that? We've got the Regional Housing Council, we've got cities doing all sorts of things with emergency plans and staffing, and, how could the Board of, what can the Board of Health do? And then what should the Board of Health do to not duplicate, not get in the way of other work going on in the county? Because the ideas that we were interested in did relate to that. We looked at, there was something raised about our use of pesticides in the county on vegetation and water. A little more background needs to be brought forward on that. Staff is going to follow up with legal on some of the questions we had about our authority, and so we kind of recapped for Jen, Dr. Friday, like what questions did we want to get answered before we kind of made a final decision. But the one issue that had been percolating, as your public comment said, since the last year and before, was septic policy. And so that was one where staff has already worked on some ideas, and we're excited about some of them. And I was interested in that, as the gal said. And so we think that one is one we're probably going to bring forward. Maybe at the, next meeting. Staff is going to put together some more specifics based on the concepts that we discussed, and that would probably be the first thing that we bring forward as a possible action item, not action item, but an item to be worked further on to develop for the Board of Health. Won't be the only one, but given the gap that we have from September to now with staffing and the pause in subcommittees, we didn't want to wait when we had something kind of ready for maybe some work to be done in 2025. So that's coming, and it'll somewhat address what we heard in public comment, although I do have a question, maybe for put it on your follow-up list, but when she said that the fees we charge are to manage all of the septics across the county, that's incorrect. That's not my understanding. Yeah, so I want if that's not correct, I don't think it is, then I'd like, maybe we can reach out to that person and just correct that, because the real issue is we do charge fees, but they're to manage certain types of systems and in certain places. The question that we're going to bring forward is whether we should expand that, and if so, how much and where and in what ways. I'm pretty confident we should, but just to throw my cards on the table, but I think there's a great discussion about where and how and kind of how to baby step that approach. Right now we have special fees that apply to Henderson Inlet and Nisqually Reach that relate to shellfish protection districts, and then we have complex systems like the one the public commenter owns that automatically have a separate type of a fee associated. But other than those two groups, no. Tuffton and Eldon Inlet or two other marine inlets with shellfish problems and water quality problems, that would be one obvious step forward, but that's something to discuss at a later time. So that's kind of where we got it. Did I miss anything, council, committee members? We're all very excited about, we have Clerk Gilman added to our committee with Tanzania and Commissioner Mejia, so it was great, and we're looking forward to bringing forward some ideas in 2025.
And any questions or other follow-up from anyone? No, thanks. That was really interesting and informative. It's nice to see the subcommittee work start to flow. It's really exciting. All right, and then next we had a really good health officer and department director report. And so Dr. Abdulmalik did a really good review of kind of like RSV, flu, measles, bird flu, and then Dr. Freiheit did the kind of what the activities are open to the community that you could look at and see or refer people to. and kind of some highlights of the department wins if you want to review those. And certainly any questions for either of them.
And we could just add, yes, if you have any questions, I know we're talking about in the open discussion more about the effects of federal changes. There's a small blurb on that on the Health Officer Director report, and I would like to give Dr. Bay the opportunity when we start the discussion to sort of talk about how it's already affecting our work with data and all of that. So, thank you.
Yeah.
I just want to share that at the time of writing my health officer report, we hadn't had an MMWR. There were two articles, I believe PFAs, from the fire in Hawaii and then emergency department use during the fires in LA that were released on Friday as part of an MMWR. I just wanted to update that.
What is that acronym?
It's a publication of the CDC.
That we use often when looking at data, so that was a bit of a shock for us when all of a sudden we had no access to that data.
Yeah, the vaccine information sheets went missing for a few days and were changed. We have some before and after to compare. So, and we're by law have to give those out. So there's been a lot of information where you go look for it like you normally do and it's not there. So. Great. All right, any other questions for either of them?
Am I remembering that, was it in your report, maybe it was the Olympia, I'm not sure, but there was something about a bird flu in Franklin County, Washington State.
Yeah, so bird flu continues to be an issue. It's spread widely through in the wildlife population. There have been multiple poultry outbreaks. So we had the first poultry outbreak in Washington State of 2025. That I noted in my health officer report. It does continue to be an issue. So far, we haven't seen human to human transmission.
But if it came to Thurston County Farm amongst chickens or birds, what would we have to take some kind of action?
Yeah, so this is one of those areas where WSDA takes point for the animal health side of it. They coordinate with the State Department of Health. State Department of Health coordinates with local health jurisdictions, and so a lot of our role is in monitoring folks who may have been exposed to highly pathogenic avian influenza and monitoring them over the incubation period of the virus, which is about 10 days. And then if somebody were to develop symptoms, then we would be coordinating testing and helping be the liaison with local health providers.
If I could just add another quick update, only because the department is getting several calls a day about songbirds. There is no proof that songbirds have contracted HPAI. We are telling the residents to dispose of the bird like if they found it in their backyard by the bird bath or whatnot. There is nobody that is testing songbirds, so people should dispose of it, not save it for us.
We were speaking informally before the meeting began about it feels like there's a lot of people becoming ill right now. And I'm wondering if that's your perception officially and what you would suggest I say in my council report tonight to the community. What should we do?
So we are seeing high levels of viral respiratory illness. It's a little bit challenging to quantify, but of the three diseases that we're tracking, COVID, influenza, and RSV. Influenza and RSV are both above the alert thresholds for Thurston County and have been for some weeks. Only a subsegment of these diseases are notifiable. So pertussis, which we're seeing we're seeing a significant number of illnesses, which is a bacterial illness. As well as the CDC released some information about nationwide, in the last couple of months,
nationwide about mycoplasma, which is another bacterial illness. In addition to circulating illnesses, are all contributing to the illness that we're seeing in our community. A subset of these are notifiable, so not all respiratory illnesses are notifiable. And so, so in terms of having granular data, it's the more detailed data is the data that you see in our respiratory virus reports, which are emergency department diagnoses. What I would say for folks is a few things. One, if you're sick, please stay home. Stay home until you're fever-free for 24 hours without using fever-reducing medications and your symptoms have gotten better. And then after that, consider taking additional measures to prevent spreading illness to other people. So distancing, wearing masks, paying extra attention to hand hygiene and respiratory etiquette. Would all be good things to do. And then just take extra care around those who are most vulnerable in our community to severe illness. So, folks that are very, very young, and then folks who are on the older end of the age spectrum, and as well as folks who are immunocompromised. We're really in the midst of it right now, and we're continuing to follow trends. So, as of this week, our influenza as a percentage of ED department visits continues to go up, and we're seeing a lot more of that than we saw last season.
And you can tell them it's the worst influenza season I've ever seen. Yeah, it's impressive. Lots of pneumonia. There has been a baby who died of pertussis in our state this year. I've had a severely affected little one as well. And again, it's just sort of that a lot of people are like, oh, I just have allergies, and then go hold a baby, and then the baby's super sick. So just be super careful.
Thank you for that. And I guess one last thing is it is not too late to get vaccinated. There are vaccines for COVID, influenza, and for some folks with for RSV as well. So just want to put a plug in there. It's not too late.
There is a medication for influenza. If you start it in the first 48 hours, it has the potential to decrease the length and severity and risk of secondary pneumonia and stuff. So.
That's cool.
So can I ask you about, so is that's only prescribable?
Yes.
There's now COVID influenza rapid tests. So that's helpful if you're feeling like you're coming down with something. That would be a faster diagnosis you need.
Yeah, people testing and then calling me for the medicine.
Yeah.
So.
Interesting. I'm just going to say this as a person who cares for someone who's immunocompromised, that I like to say in public or to others that, when someone's wearing a mask, so this is something I never thought about until this happened to me, but that other people wearing a mask, for example, football party this weekend, I sent a message out to say, if you're showing up to this party and you have any symptom, I need you to wear a mask. Or even if you had one yesterday. And so I think that's making it known that wearing masks is not necessarily because they're weird or somebody is because they're protecting themselves or others. And so I've been trying to really vocalize that lately. Yeah.
Thanks. All right, we've got 10 minutes and last agenda item. So the last thing that Carolina and I thought would be helpful would be just getting a little bit of the pulse of what you guys are hearing in your kind of professional realms that you're working in, or with family or friends, or things that you're hearing about that your health concerns that we should be thinking about, or that you're being impacted by with all the changes federally, or if the other thing we thought we would bring up is just throughout the year, maybe we can find a time or two that we could do some of that ambassadoring where we are working on loneliness and perhaps like going places where we can take walks with people or talk to people or get together. So yeah, so I don't, would you want to just maybe go around and anyone who has anything to bring up or add, that would be good. Do you want to start?
Yeah, if you don't mind. So part of the discussion that we had at the executive committee in terms of the effects on federal changes and health effects on community is that the immigrant community in our county is scared. And as an immigrant myself, I'm scared. And you know, I remember being a child and going through school and being absolutely terrified. And as we're going through this situation, right, I think, you know, the Scout Council spoke about it, but we're creating trauma in a lot of children. And I just think that, you know, church services have been canceled or moved via Zoom in a lot of Latino and Asian communities, just here in our county. So this isn't something that's happening in the state. It's not something that's happening federally. It's here in the community. People are scared. If you go to a lot of the Latino stores, they're fairly empty now, and people are scared to just go to those stores. It's very realistic, and I think that it's something that, as we're talking about mental health, as we're talking about loneliness, as we're talking about racial justice, like all these things, I think that's just something that we really need to be aware that it's happening here in our community, and that people are being affected here in our community, and that is having health impacts. You know, people are like afraid to go to the hospital to have their babies. Like this is just going to go down. People are going to be afraid to go to the doctor to get their kids vaccinated, and you know, as we were talking about this in the executive committee, I was like, well, what are things, right, that how are these federal executive orders are messaging impacting our community, and like having just kind of this conversation. And Dr. Fry brought a really interesting point during that meeting, and probably I'm taking away your thunder, that in the point in time count, people are scared to go talk to the volunteers right now, right? So it's also affecting our vulnerable populations that, you know, and we rely on the point in time count, and yet they're scared to go talk to the volunteers or anyone with an official badge. And it doesn't matter that, you know, if the volunteers have connections. I've heard it from several volunteers who are deep in, you know, communities. They do the work, but yet people are just scared and they don't want to provide that information. I mean, that's going to skew point in time numbers, right? And I'm just seeing a lot of these impacts already having an effect in your community, and you know, it's derived one out of fear, and so just wanting to kind of seeing as there are other impacts in our community, right, that we need to be aware of or talk about, that you know is happening, and it's going to have an effect later on. You know, for me, I'm thinking about all the children who are scared, and you know, again, the trauma and the mental health issues that we're really creating within them, and or that this is creating, and you know, we're going to see it once they're teenagers and adults, and
So I can add to that a little bit. We have families keeping their kids home from school. Chronic absenteeism rates are going up. We have families both in schools and in our workforce that are mixed immigration families, and so we don't necessarily realize that, but it's true. And so the stress and trauma on both the workers and kids and their parents are incredible. Washington, which is a school in our region, they bring tribal members from many counties all the way around. They're instructing their kids and families to carry their tribal cards with them because they can easily be mistaken for immigrants.
And
The rates of bullying, especially in our elementary schools, have gone up incredibly. It is that you're right. The impact of the trauma and the vicarious trauma that staff that are working with these families are going through cannot be underestimated.
I will say too, just to add to that as well, that in the recovery community, this is also a major issue. Even folks not willing to go. We have several, I'll say in the 12-step community that there'll be several meetings online, people worried about and or needing to carry two pieces of identification in order to and do anything. Along with some vacancies in treatment centers where people, check themselves out. They check themselves out. Obviously, the risk of being in an institution for their health, of being, not safe. So seeing that there as well.
It's not just our immigrant communities and people of color, it's also our LGBTQ and trans families who are frightened, who are moving in some situations to get out of the country.
I had an update yesterday about our refugees our newcomers who've been settled most recently. We have 48 people who are within their 90 days of receiving initial services who were just kicked off on January 20th. When the nonprofit agencies were instructed to no longer deliver services. So there are volunteers filling in, but historically they've got Pierce County Health Department for their initial health screenings. So appointments getting scored away, getting registered for school. So it's kind of volunteers pinch hitting. The specific fiscal impact was World Relief did not receive $140,000 that they would have received for these 48 people who are our most recent refugee arrivals. So that's another specific impact right now.
There's a lot of vulnerable populations that are being impacted.
Anything you want to bring up?
I didn't actually gesture to say anything, but I just echo everything that's been said. And in the recovery community specifically, I know individuals who no longer attend recovery meetings, and those are extremely helpful to them, but they're scared. And so it's creeping into domains that we might not think about if we don't know someone personally or if we haven't heard what's going on. But I guess my question, unless maybe Commissioner Mejia was getting to it, or someone else might be ready to answer, but what can we do? How can we take a stand or make a difference or help in some capacity, either as the Board of Health or in any capacity?
And that's something we were talking about is how do we actually make the board instead of just we proclaim? It's how do we actually help make a difference and an impact? So I think we really will try to at least do a few things this year. And that's why it's really important to hear kind of what your priorities are and what you're really worrying about and hearing about and seeing.
Yeah, I will say, I know that other folks in the room have connected with organizations that are working with immigrant and refugee communities. One group I've been working closely with is Washington Immigration Solidarity Network, and I attended their advocacy day a couple weeks ago and got a stack of red cards for donor rights that have English and Spanish, and I'm hoping to get other languages too. So maybe we could keep those on hand in this building, or Board of Health members maybe who want them. I don't know. I could probably help get red cards for people. That's just one small thing I do. I always have it on me just in case. But any other ideas? And we know that our sheriff has stated that he won't be working with us directly to facilitate any sort of arrests or anything like that. So that's good, but there are unprecedented challenges associated with this. So any other ideas, I'd love to hear them.
So do the health department staff have similar policy or direction to the sheriff's letter about not sharing personal information? Good.
because we do have clients in our nurse family partnership program who don't want to see the nurse anymore. They're afraid that they'll bring people to the house. In our Office of Housing, Homeless Prevention, and Disease Control and Prevention. So those are sort of direct with various populations, and that they're all seeing those sorts of things. So we're working on what could be that packet that could be distributed to the clients who are asking for what their rights are and what they need to know should anything happen. I will just tag on to what Commissioner Mejia said was last year's point in time count, just as a point of reference. For example, I was at the 6 a.m. UGM when in late January as folks were coming out of the shelter, and I did 23 census counts that morning. So this was 2024 January, and there was four or five other people that were also. So 23 myself alone. This year, just the other week, that morning in UGM, 7 total people. So when I say it's going to affect the counts, it's going to affect the count, which is going to affect future funding. So we are already seeing direct impacts.
Anything you want to add, Heidi?
Very strongly and highly concerned about trans youth and their families in particular. They are hanging out there right now in a situation where many youth and families in our community just are coming out of this mental health crisis that's been going on since the pandemic. I've heard narrative stories from people that I know in that situation who are just about ready to just give it up. They don't know what to do, and it's very concerning.
Commissioner Fournier? Anything else you want to add?
I have questions on some of the details of what's going on. On this topic that we're discussing, I try to think about what Commissioner Klaus said, like about what can be done. That was the only thing I can think of, because the people that are making the changes don't care about any of the things we're talking about. So I'm trying to figure out who does care. Like, it's not. The only thing I can think of would be to compile some of these impacts that we're you guys are hearing about and documenting. And the letters need to go to, in my opinion, the letters need to go to Republicans who are reasonable, who might care about this, who would be in the conversations with the people making decisions, whether it's Congress, the more moderate members of the Republican caucus in Congress, or local Republican leaders. So if you guys are in these conversations, we're on the outside. These are things we need. You might be motivated by this, and not seeing all these demonstrated impacts of this decision that looks kind of good from your perspective at the top. We just want you to know it. And true people in those conversations that I can tell you that would care and that can voice concern about some of these impacts. That's what I can think of, because, like I said, I think the people that are coming in strong with this stuff, they want to make their statement, and they don't care about any of this.
I guess I'll just add in the, what can we do, right? I've been very deep into this, and again, it affects me personally, it affects my family personally, so I have to pay attention to what's going on. And so, I started attending. I was avoiding the immigration piece of the National Association of Counties because of how heated it can get. But now the Hispanic Association of County Officials have asked all of us to join, so we're going to be shoring up in coursework. The Hispanic Association of County Officials across the U.S. are compiling information because they are kind of doing that outreach, and I will be going once again at the National Association of County Officials and lobbying to different representatives across the U.S., different Congress people, and I would love that, especially as I'm up there. I think that would be very impactful. Here locally, I've been also talking with a lot of representatives up on the Hill there was a conversation specifically about birth certificates, right? And the processing of birth certificates and people trying to get them. And I was so happy to hear that our own public health in Snohomish County, it takes 3 to 5 days. Whatcom County, it takes 5 to 7 days. And here in Thurston County, it's a 24-hour turnaround time. 10 to 15 minutes if you're there, 24 hours if you're ordering that. And I was just like so excited to hear that and just so thankful to our public health and social services staff that they're able to really turn around and stuff and do that. So we did some data to some representatives and birth certificates and being able to process those and kind of some of the issues with DOH, with the holdup is sometimes at the Department of Health and not really here locally, but resources that they could offer us. So I think there's different ways to plug in. I would love to hear from the board, especially as I go to NACO this March, and just showing that, you know, we are in communities in tune, and this is something that, you know, is affecting us here. So thank you for that suggestion. I'm happy to write something up and pass it over to Jen so she can pass it along.
This is a perfect time and example for the Board of Health. I appreciate it.
I have a question about that. Would it be a letter, like a general letter about this topic that you could present during any testimony? Or are you looking for specific bills, letters for specific bills like the commissioners do? I know there are a number of bills related to immigration at the state level as well that we could maybe write letters for. So I'm just wondering how, like, what more, if there's more context that you could provide about what exactly you would like, because I'm happy to help in any way with the state letters, or however I can help with any of that.
Well, for this letter that Commissioner Menzer brought up, it's just at the national level, since that's where we're going to be hitting kind of how he suggested different members of Congress, and we vary those out, and so distribute those out towards different representatives across each state. So I think just the national level for now, and then the Board of Health would like to plug in here at the state level, then I think that would be.
I can modify it.
Okay. I'm happy to help with any state level letters. I know a handful of bills related to this, so maybe I could help draft something up for the Board of Health if there's interest in signing something at the state level as well.
You guys, I mean, just one of the things, I mean, because it is an interesting thing that some people don't think about. When we had this situation before in the last administration, Trump administration, we had the whole thing at the courts. No one brought that up, but people weren't getting justice because people are afraid to go. They were actually, we had evidence that ICE was actually people are speculating they're going to come to their AA meeting. They were coming to courts.
Yes.
And we knew that. They were going through court things. They were trying to get cooperation. If they couldn't, they would cross-reference the docket for that day with their own lists, and they were pulling people away. So that, just another community impact. Cases aren't getting, prosecutors were having to dismiss cases because key witnesses wouldn't show up, and that actually went to federal court, and there was favorable rulings on that back in whatever year that was, 2017 or 18. So anyway, it's just there's so many pieces just kind of downstream impacts to something like this that does affect all the parts of the community, all the different things, something that's going to touch everyone, whether they're willing to, think about it or let it touch them. I mean, it's a wide-ranging net that this type of thing disrupts, and it's good to highlight those specifics because they're all happening here, as you guys said.
The last thing that I am really, really worried about is vaccines, Medicaid,
Yes.
Medicare funding. If that stuff gets blocked, our whole healthcare system is.
Federal funding in education for our most marginalized populations.
Yeah.
Those are all threats at this point, but that doesn't mean tomorrow they won't be real.
Yeah.
Head Start portals being turned off and on. I don't know if you're following that, but that's real. The funding portals being turned off and on, which makes it very difficult to administer a Head Start program, right?
Yeah, so we'll just be on it and we'll respond as best we can. And if you have suggestions of like, oh, this is something we might all want to comment on, I think we should be very active about
I think
doing
it's just so
that.
important to be visible and honest, and it's not the time to be meek and avoid.
Courage.
If I could add something, but I didn't want to interject the open discussion, so I didn't know if we were done with the open discussion.
Thanks. Feel free.
Okay, I would like to just keep you one more minute because I need to turn over to Dr. A for a very important announcement.
So I am stepping away to do more clinical work with underserved communities. My last day will be the first week of March, so March 6th. I did want to say that it has been incredible to serve as Thurston County's health officer. You know, I'm looking around the room, and some of you I've been working with, since I first came in July 2020, and some I have, been working with for a much shorter period of time. But as I look around this room and as I hear our discussion as a Board of Health, I am really excited and hopeful for the direction that we're going in as a county. And I really appreciate Dr. Freiheit and all of her work as well, to kind of taking on our department and marching into the future. And so it's bittersweet. And I'm really excited for my next step, and I will be around in our community at least part-time for the foreseeable future, so I'll be supporting from the outside.
You come make a public, you and come give a testimony?
I just want to say thank you to Dr. A because you came right in the middle of a pandemic.
Yes.
You served this county, you served all the residents tirelessly every weekend since then has been on call for all the various calls and everything. And so your passion, your dedication, and your service. Thank you so much. We're presenting you with this certificate and with a beautiful plaque.
Board of Health, smile.
You're supposed to be frowning.
Thank you. To you.
Excited for your next adventure.
Thank you. Sorry, that was
No, that's
late breaking news that I wanted to make sure you all knew. And just moving forward, because you all approved last month, we'll be signing that regional MOU that I was going to do preemptively, and now it means something. So we'll be getting that regional MOU signed so that we have Dr. Alice Tin as our interim while we post and figure out the process for you all to appoint the next health officer. So.
Claudia, I raised my hand. I mean, your leadership through the pandemic. We get choked up, but I mean, we relied on you. We had 3 commissioners that didn't know anything about health. I was the chair of the Board of Health, and you led us with a steady hand, and I always felt confident. Thank you.
And Dr. A, they're not here to say this, but every school superintendent in Thurston County was so grateful for your leadership and your availability during that entire time. So thank you for all the work you've done with schools as well. Thanks.
Your monthly briefings to the 3 cities in the county helped to make the pandemic both more fun and make us better braced for each month's news that came. So really, really appreciate that.
And having survived the first year of the pandemic with no health officer, it was a total gift having you show up. So, thank you for all the help.
Yes.
No, thank you. I will say thank you so much. I came in right as the vaccine rollout was happening, and that was such a chaotic time. It really was. And thank you so much for always providing the information we needed to get out to the community. And you were at every vaccination event I went to. So I know you were putting in that extra time to really be sure that things were going smoothly and that people were getting their questions answered. And, I really I've appreciated working with you, and I wish you the best of luck.
Yeah, what I'll say is across the nation, health officer is a rough gig.
Yeah.
And understanding that you did it with a smile. And I asked someone, did she always have that smile? I was like, yep, always had that smile. I know the organization valued that. So we wish you all the best.
I've embarrassed her sufficiently now, so move on.
All right, so I will take a motion if we are done with this meeting.
So moved.
In a second. Okay.
Oh, sorry.
All right, all in favor of adjourning this meeting?
Aye.